And I have another question about Mount Hope on a recent list of zip codes that Providence has opened up. Helen might want to speak to this, but 02906 was not in there, and I know 02906 is covered under Mount Hope. Has that made it harder to get people vaccinated?
Absolutely. We have not just elderly, but people 50 and over who have 2 to 3 health risks. And every time they go to fill out a list, now even at a 02906, the list is filling up so fast, they don't have an opportunity to get on the list. So they're home waiting, especially the elderly. And what we see now is people are tired. They're tired of staying home, they're tired of waiting. Now they're playing basketball, they're living their best lives without masks, without vaccines, and it is just furthering the inequities and the sickness and illnesses that are going on due to the COVID virus. So now that we are on the list, it is helpful, but again, the lists fill up so quickly, we don't even have the opportunity to have as many people as we would like to be vaccinated.
Thank you.
And as I would say, one of the other issues we have is translation. We have Creole, we have Spanish, and we have Russian individuals, populations on the east side, on the lower east side, and they need help. And if they have no translators, or people literally coming to the high rises or Charles Gate or University Heights speaking their language, they're being left behind and they're afraid. So not only do they need to know how to register for vaccines or have vaccines come to them, they need to know that it is safe and it's free, because some people still don't think it's free.
I just want to, just to also mention that I think we need to be careful with what we've seen Blue Cross Blue Shield Rhode Island attempt to do. You know, we know that the emergency orders and the ability to get vaccines for free will eventually end. And so the question is the rollout, is the timing and the urgency that we're placing now on vaccinating BIPOC communities fast enough to address not only the I would say, maximize the good that we can do within the time frame of those emergency orders, but also to protect these communities from the very institutions like Blue Cross and Blue Shield that are threatening to send bills to our families. That is a real issue. It has been an issue in Rhode Island prior to this crisis, but now we have to ask ourselves, are the families that are, again, disproportionately getting sick and hospitalized now faced with risks for having to pay thousands of dollars in COVID-19 bills? That's a question that we have to keep open, Steve, and hopefully we can all, collectively move to push back.